Great to have you on board today with us on this Parichay webinar series by greytHR. I'm Rakhi Gautam for the audience from greytHR, and it's lovely to have you all join us today for this very special, insightful session that we have planned. Before we get into all the interesting things that we're going to be uncovering for you today, let me give you a quick introduction about the topic, about the speakers, very special speakers who we have today, and we can take it from there. Uh, Audience in the audience, you can give me like a thumbs up if you are listening to me or you're able to hear me properly. Let's keep the engagement going. Thank you so much for that. So again, it's my honor to welcome you all to our very special episode today, and happy to share with you all that this is the 100th episode of the Parichay webinar series. It's a milestone moment for us, and we are so delighted to have you all here today. And to make it more, special, we have the officials joining us from ESIC, and there's lots to cover. Now, for this special session today, we are focusing on a topic which is of great significance to not only the employers, but also employees, which is the latest ESIC SPREE scheme. And we'll be discovering, facts and guidance for employers and employee registration during the session as we go along. And with the government's recent push on SPREE 2025, I think it becomes crucial to understand how the scheme simplifies compliance and ensures welfare for the workforce. Now, before I dive into the topic, let me quickly take you all through the agenda. The first part will be the presentation by our experts, which will then be followed by an audience Q&A. So audience Q&A is where time is all yours. You can start putting across your questions in the panel of Q&A, which is there on Zoom, and we'll take your questions one by one. And the session is currently being recorded. So if you happen to miss out on anything, do not worry at all. We have got you covered. We'll be sharing the recording of this session with you by next week. So you can always watch it later and take all the insights that you might have missed in the first session. Now, without any further delay, let me quickly introduce our speakers. Can we switch the PPT, please? Yes. So we have with us Srimati Abhilasha Jha, Regional Director at ESIC RO Maharashtra, joining us. Abhilasha ma'am brings us over 25 years of extensive experience with ESIC, having contributed across diverse domains, including administration, insurance, revenue, and employee benefits. Her tenure in various offices across Maharashtra and other states, such as Bihar, West Bengal, and Karnataka, has broadened her professional expertise. After serving as head of office in Bangalore and Marol, Mumbai, for nearly 5 years, she has now been appointed as the head of Maharashtra. Once again, ma'am, it's a pleasure and honor to have you here with us. Thank you so much for joining us.
Thank you.
Up next, we have Shri N.K. Singh, Deputy Director, ESIC RO Maharashtra. N.K. sir brings over 18 years of experience with ESIC, having served across diverse areas, including revenue, legal, benefits, and recovery in locations such as Nagpur, Chennai, and Mumbai. He's currently serving as branch officer benefits and medical benefits at the regional office in Mumbai. Thank you so much, sir, for joining us. It's a pleasure.
Thank you, madam.
Up next, we have with us CA Vijay Bharech, partner at Deloitte India. Mr. Vijay comes with over 15 years of experience in individual taxation and social security advisory, focusing on employment tax, stock rewards, globally mobile employees, labor codes, and bilateral treaties. He advises on payroll and employment laws and transformation and initiatives, helping corporates optimize costs through effective salary structuring and use of double taxation and social security agreements. Vijay has also worked in Deloitte's UK office. A chartered accountant, he contributes to leading financial publications and serves on the HR and Industry Institute's Interface Expert Committee at the Bangalore Chamber of Commerce and Industry. Thank you so much, Mr. Vijay, for joining us. It's a pleasure. Thank you so much. So that was all with the introductions. Now I would like to hand over the session to Mr. Vijay to take the conversation ahead.
Thank you, Rakhi, for having me here. And welcome to Abhilasha ma'am and Singh from ESIC Maharashtra. Good afternoon, audience. What you are going to hear from ma'am and sir today is about the scheme for promotion of registration of employers and employees, as is called SPREE, which was launched by the ESIC office in the month of July early this year. The webinar will largely cover the following topics: the key features and objectives of the scheme, why it has been rolled out, how the scheme simplifies the employer and employee registrations for the larger welfare, what are the compliances requirements and the benefits which employer and employers are going to get after registrations from the scheme when it will get rolled out. Then the last one is on the practical insights and the best practices to ensure the smooth adoption of the ESIC SPREE. With this, let me hand over to you, ma'am and sir, to take through the presentation for the audience.
A very warm welcome from ESIC. As you know, the ESIC is Employees in State Insurance Corporation. It is the social security network. It provides social security to the employees who are working in an sector. So right now the scheme is extended to only for organized sector, where the employer is having at least 10 persons, 10 or more employees working for them, irrespective of the wage ceiling. So for coverage, we would be taking 10 persons, like 10% should be there. While asking for contribution, we would be considering only those who are drawing up to 21,000. The present wage ceiling is 21,000 per month. So for calculating the contributions, we would be considering only those coverable employees. After registration of a particular unit, we give that unit a code number, a unique 17-digit code number is being given to them, and the act is becomes applicable to that unit with effect from that particular date from when 10 employees were working for that unit. So as of now, the employer has to take registration by his own whenever 10 or more persons become 10 or more persons start working for him. So from that particular day which the unit becomes coverable, from that particular date we start taking contribution, and the various benefits which are being extended to the insured person, the workers who are working for him, who are drawing wages up to 21,000. So that they are called insured persons. A unique insurance number is being given to them after their registration. After registration of that employees, they have to give all the details of their family members, the dispensary, their home address, permanent address, and etc. So insurance number is being given to that particular insured person, IP, and the act becomes applicable, and he is entitled to various benefits which are given to the IP and his dependent family members under the ESI schemes. So first of all, the basic criteria is the unit has to be covered with 10 or more employees working for that. And after that, the scheme is extended to the workers who are drawing only wages up to say 21,000, the present wage limit. So we would be discussing about the various benefits under ESIC scheme at length, and the spree. If the employer does not register within 10 days when the act becomes applicable to him, various legal repercussions are for him. So he would be subjected for backdate contributions and interest damages like that, or he may be also subjected to some litigations as well. So to avoid all that, we have launched a special scheme called as special scheme for promotion, SPREE, scheme for promotion of registration among employers and employees. So that scheme is applicable from 1st of July to 31st of December. If employer declares his registration number between this date and whatever date he declares, if it opts for registration during this spree period and declares whatever date he feels so that would be accepted by the department without any past contribution or interest claim and without any inspection of prior period. So this is the golden opportunity for all those employers who have been left for becoming covered under the ESIC, and also for all those covered units who have n- not given insurance number, who have not taken insurance number for their coverable but not covered employees. So those employees who have wages up to say 21,000 but they have not covered, so they have not been registered and not been allotted insurance number so far, the employers can now register them under spree, which is very golden opportunity for the employers. And then they will be entitled for various benefits, the major five, apart from major five benefits that we have under ESI scheme, and other benefits are also there. I would be particularly bringing you highlighting that is a benefit, that is ward of IP, that last scheme that you are seeing in the screen. So reservation of seats under ward of IP scheme. So the IPs, the insured persons whose children are they have qualified in the NEET exam, so they would be given reservations in ESIC run medical colleges, dental colleges, nursing, paramedical. So all those colleges, ESIC is offering medical courses and paramedical courses at a very nominal fees, 24,000 per annum. So the meritorious students who are deserving candidates, they would be availing such scheme for the this under ward of IP scheme for ESIC run medical and paramedical colleges. Apart from that, we have five major benefits which would be discussing at length: medical benefit, sickness benefit, disablement, dependent benefit, and of course maternity benefit, and employment allowances, funeral expenses, vocational training and rehabilitation. So Mr. Neeraj would be telling you about that in detail. So I request all of you CAs and other employers who are in contact with other major employers. So please ensure all your contractors and other sub employers, sub vendors, subcontractors, vendors to have ESIC registration, and then they would be passing on the benefits to their workers. A healthy workforce would be ensuring a peace of mind to the employer as well. So benefits to employers also would be would be discussing it later in this PowerPoint presentation. The contribution given under ESIC scheme would be exempted from income tax. So an employer would be having a healthy workforce at his disposal without worrying about the compensation or some other benefits, monetary benefits that we would be offering. So employers and their employees, they are all are called upon to avail this opportunity of registration under spree, so that benefits of this noble social security scheme are passed on to each and everyone. With this, I hand over the presentation to, I ask Mr. Neeraj Singh to continue with that. Thank you.
Thank you, madam. We'll start from the first slide. Can you provide me the first slide?
Neeraj ji, I have another meeting coming up, so I'll be taking leave of you.
Okay, madam. I'll
Thank
take.
you, Mr. Vijay. Miss Rakhi, I'll take leave of you.
Thank you.
Thank you, ma'am.
Thank you so much, ma'am, for being here. And we'll continue this meeting with Mr. Ankisa. Thank you so much for joining. Just before we start with the presentation for the audience, you can start putting your questions now. I can see a couple of questions already. Once we are through with the presentation covering in detail about all the various schemes which are shown on the screen, we'll take the audience Q&A. Thank you so much for being here, and over to you, Mr. Ankina.
Good afternoon to all. I'm already introduced by Rakhi madam. I'm Neeraj Kumar Singh, Deputy Director, looking after benefit matters in our regional office. So actually, madam has covered almost everything. Our Abhilasha Jha madam, she has covered everything. Whatever benefits are there. Still, I'll continue with that benefits. First of all, let me tell you the ESIC. What is ESIC? ESIC is ESI Act is a very old Act. 1948 ESI Act 1948 started in 1952 from Kanpur. So this is a Social Security Act. This provides social security to all downtrodden workers in a organized sector. So our base ceiling limit is only 21,000 rupees. That is gross salary of 21,000 rupees. In present scenario, 21,000 rupees is very less, but government has not increased since 2017. So our gross wage, that wage ceiling limit is 21,000. We take contribution of 4% from the employer. Total contribution is 4%, 3.25% from employer and 0.75% from employee. So if you see the employee contribution, if a person is getting 20,000 rupees, we take 150 rupees from him, and yearly we take hardly 1,800 rupees from employees. And then we provide various benefits. That benefits we will discuss one by one. Second slide, madam. There are 5 major benefits. That's why we say our office has a Panchdeep Bhavan. We say Panchdeep means 5 benefits. The first, medical benefit, sickness, maternity, disablement, and dependent benefit. Medical benefit is provided to the person who is registered under ESIC and his family member. So medical benefit, total medical, we have so many dispensaries here, 110 dispensaries, then hospitals are there, 12 hospitals are there of ESIS, 3 hospitals of ESIC. Then we have around 200 tie-up hospitals where the treatment can be taken up by the beneficiaries. Beneficiaries means IP and their family. So all type of treatment, there is no cap on treatment, and this medical benefit is being provided from the day one. The person who joins today, registered today, he and his family is eligible for medical benefit from day one. Likewise, there is a second benefit, sickness benefit we provide on contributory conditions are there. So 70% of the total gross salary, whatever he was getting when he is sick and he is not able to go to his office, then we will be providing him the sickness benefit in form of 70% of his gross salary wage for the absence period. The abstention period, for the abstention period, we provide sickness benefit. For maternity benefit, the IW, the lady who is working, who is insured woman, insured person, and if her confinement is there, we provide 100% of gross wages for 26 months, 26 weeks. That is called, that we can say 6 months salary to her. And of course, there is a contributory conditions in this also, maternity benefit. In disablement benefit and dependent benefit, these 2 benefits are provided to the employee from the day one itself. If any accident happens due to employment injury, then these 2 benefits we provide. Employment injury covers everything, that is in office. If he gets injured by any machine or anything, or any heart attack is there, brain hemorrhage is there, and it covers from the residence to the workplace, the commuting accident, during commuting also he gets injured, from workplace to residence and residence to workplace, in between anything is there, then we that is called employment injury. And if employment injury is there, there will be three conditions. Either the person can die, then we will provide dependent benefit to the dependent of that IP. If he has temporary disablement, means he is injured but he will be fit, so during that temporary period, disablement period, we provide 90% of the total gross salary to him when he is absent from his workplace. If he is permanent disabled, then we provide pension on the basis of loss of income. Whatever is the loss of income, then we provide the pension to them. Suppose a person gets injured and his loss of income is around 50%, then we provide almost 50% of the salary as a pension to him. That is called permanent disablement benefit. These 5 benefits, out of, as I said, that 3 benefits are provided from the day one itself. Only 2 benefits are provided after 9 months. That is sickness benefit and maternity benefit on contributory conditions. There are other benefits in second slide. You can move to second slide. We have Atal Bimit Vyakti Kalyan Yojana, that is for provided to the IP when he is unemployed for 90 days temporary unemployment, then 50% of average daily earning, daily wage, and then there is a scheme of called RGSKY, Rajiv Gandhi Shramik Kalyan Yojana, that is called unemployment allowance. That is provided when a person is unemployed due to closure of factory, retrenchment, or disablement due to non-employment injury. On this case, we provide 24 months unemployment allowance to him, 50% of the average daily wage for the first 12 months and 25% for the last 12 months. Then there is a confinement expense when we are not able to provide ESIC medical services to the lady, either IW or a wife of IP. To both we provide 7,500 rupees we give to her for 2 confinement. Then if a person is died, and he will be given funeral expenses of 15,000 rupees. And there is a vocational training, physical rehabilitation, and vocational rehabilitation also. You can see in the slide. As Madam has said, that last point, that is quota in medical colleges for MBBS and paramedical courses. We have reservation of seats of ward of IP, means children of IP in ESIC and medical and paramedical college. There is a very big benefit. The total fees, as Madam has said, to only 24,000 rupees per annum, means 2,000 rupees per month. Fees is there if a person qualifies in NEET, and there is a reservation in our ESIC run medical and paramedical colleges. We have around, at present, we have around 13 medical colleges and around 9 paramedical colleges in all over India. Next. This is a jurisdiction of RO and SRO. That is not important. Next. In Mumbai, in Maharashtra, we have so many offices: SRO Marol, SRO Thane, SRO Pune, SRO Nagpur, SRO Aurangabad, SRO Nasik, and our regional office in Parel. Then 91 branch offices are there, 22 dispensary cum branch offices are there, 3 tie-up ESIC hospitals are there, and 117 SST tie-up hospitals are there. There are also tie-up hospitals for secondary care also. Next. These are the numbers of employers and employee in our state. Total number is around 48 lakh insured persons are there. So we provide this benefit. And when we say that beneficiary, we calculate it is 3.88 into our total number of insured person. Around 1 crore 90 lakh beneficiaries are there. 1 crore 88 lakh. Okay, next. This is the data. 3 number of ESIC hospital, 12 hospitals by state government, DCBO 22, ESIC dispensary 111. There are IMP 502, number of new dispensary, that is not important. Number of new hospital that is going to come up. ESIC secondary tie-up 302 and ESIC SST tie-up hospitals 171. Then we come to what is the benefit of employer. If he covers his unit, what is the benefit? Actually, employer has to cover the unit when the unit is coverable, when the company starts and the number of employees reaches 10. Within 15 days, he has to cover his unit. So what are the benefits? First benefit that already madam said, that the peace of mind will be there if he is providing all facilities to the IPs. So liability of providing medical facility to employee and their dependents in kind or in form of fixed cash allowance, reimbursement of actual expense, lump sum grant, or anything. So that is actually employees are free from this. They are not going to expense on these items. Then employers are exempted from any type of act under our section 53 and 61. All other acts which is providing compensatory act to employees, that is prohibited. Once the employer or employee is covered under ESIC, he need not to apply on other act. That Workman Compensation Act, now it is called Employee Compensation Act, Maternity Benefit Act, or any other act which is to be given only to non-ESI covered employees. An employer have their disposal a productivity, well-secured workforce, an essential ingredient for better productivity. Then these are things already covered by madam. And then income tax, of course, income tax exemption is there for the contribution paid by the employer. Next. This is the difference between our e-scheme and simple insurance scheme. Our scheme is a mandatory. This is a statutory compulsion is there. So the employer who is having 10 employees, he has to cover his employees. The employees who are getting less than 21,000. So of course, then we have to see the difference. What is the difference? Simple insurance scheme covers only one person. We cover whole family. Simple insurance scheme provides only one service stipulated in the policy. We provide complete medical benefit, including sickness, disablement, maternity, and dependent benefit. Then simple insurance scheme covers only identified diseases. We don't identify any disease, and all type of diseases we cover. That is why we say total health cover. Then the saving go into the profits of the company, but our saving are kept in a purpose for being plugged back for good hospitals and tie-up hospitals also. Next, madam. There is a online service we provide through online. Every payment, everything we provide through cash benefit or any benefit we provide through online services only. There is no offline system in our ESIC. Next. Now we come to SPREE. Our main motto is SPREE, already covered by madam, that this is a special window, you can say one-time window for employer to register their factory and all eligible employees without any dues of past period. That is, period is 1/7/25 to 31/12/2025. there are two parts of SPREE. First one is employers who are coverable but not covered till date due to various reasons, due to a non-awareness, due to any other thing. If they are not covered till date, the scheme floated by Government of India, they say that if a employer is not is coverable but not covered, have chance to cover this his unit and employees for from this period to 1/7/25 to 31/12/25 and without any demand. See, first part is unit and second part is employees. There were many units, there are many units who are covered, but they have not covered all employees, especially contractual employees, they have not covered till date. So if they covered today during this period, we will not be asking any previous demand, any notice, any legal action, anything will not be taken against them. The employers registering during the period will be treated as covered from the date of registration or the date as declared by them. The newly registered employees shall be treated as covered from the date of their registration. This means this is the good opportunity from the employer. See, the employer normally, what is the difference between SPREE period and non-SPREE period? When non-SPREE period is there, if we find that if any unit has been covered on so and so date and not during non-SPREE period, our enforcement officer, that is called as social security officers, they go for inspection. If they find that unit is covered and unit was coverable for the last 5 years or 4 years, we take legal action, then contribution action, then ad hoc action, then penalty, damage, insurance, everything will be there. And there will not be any benefit will be provided to the IPs for the past period also. So this will be total loss of the employer. Now during this period, if they cover, we are not going to inspect records for the previous period. That is the main difference. Normally, we find every time our inspector goes for inspection, he finds that unit was coverable from the 3 or 4 years back. So this is the best time to cover their unit. Those who are new company or old company or any type of company, any company who is doing any type of business are coverable. There are two types of units we say. One is a factory and one is a establishment. In establishment, we cover all types of business activities. Who are doing business activities, they are establishments other than factory, manufacturing process factory. So all types of units except nowadays, at present, our medical institutions and educational institutions are not covered in Maharashtra. In other states, this type of institutions are already covered. So other than that, all type of institutions are our units, that may be establishment or may be factory. Next. So what are the benefits of SPREE 2025 for employers? That is hassle-free registration process. Employer can register their units and employees digitally through the ESIC portal or Shram Suvidha Portal or MCA portal. If any unit is registered through MCA, their private limited company, if they are registered through MCA, they are automatically getting ESIC code number. This was done by the Government of India for providing ease of business. So MCA type of employers, they are already having registered. They are already have our registration number, ESIC code number. So in that process, if any MCA employer registered through MCA, if they have 10 employees, then only they have to start the compliance of the ESIC. Then registration will be considered valid from the day declared by the employer. Already I told, no contribution liability for the prior period, no inspection, immunity against any action for non-registration in the past. So all things are there. These are the benefits of SPREE. So I appeal to all our guests, if they know any employer who are yet to be covered, just appeal them, just ask them to cover their unit under the ESI Act, so they can avail this opportunity, this golden opportunity. Next, madam. Then benefits of SPREE 2025 for employees. This avail the social security benefit under the ESI Act from the date of registration. Medical care for themselves and their families. Already told this one in first slide itself. Cash benefits in case of sickness, maternity, injury, death due to employment. Protection under the ESI Act. Then reservation of seats in ESIC medical college. This is already covered. Next. Then there is another scheme that is called, the scheme is floated by government from 1st October 2025 to 30/9/2026. This is called Amnesty Scheme 2025. This is also a one-time dispute resolution opportunity. The employer who has applied case against us, who has filed application in the, there are two types of case. One is a civil court case, one is a criminal court case. Criminal case, actually, we are doing criminal case against employer who are not complying under ESI provision of different provision of ESI Act. So, likewise, they are not providing, they are not paying contribution, if they are obstructing any our official inspector, or they are not producing record, if they are not submitting the return. So we file case against him in criminal court. We say criminal case, that is, there are different provisions are there in section 84 and 85 of ESI Act. So we file case against employer. And the second thing is civil court case. Civil court means if employer is not satisfied with our assessment or our order or our recovery notice or our coverage thing, so employer go to court and appeal. That appeal is in before EI court. We say employee insurance court, normally located in our labor court. So if they appeal in EI court against our assessment, that is called civil court. So both these type of cases are there in filed up to 31st March 2025. Then there is a amnesty scheme on that. Second slide, madam. Next slide. No, sorry. Previous slide. Previous slide. So details are not there. Then I'll tell you what is the thing. If the case registered by us on criminal in criminal court, that cases will be withdrawn by us. If employer pays the contribution, then we will be withdrawing the case, that criminal case, from the employer. So this is the amnesty scheme. If any employer who has not paid contribution and we have filed case against them, they can pay the contribution and then we will withdraw the case from the criminal court. Likewise, other things are there. If employer has not submitted the record, then they did not to pay anything. They have to inform us that this is case filed against us on this basis. We are going to withdraw the case from the employer, from the court. If they filed the case against our assessment and they are not happy, and the case, actually, the case, there are three courts. Normally we go to EI court, then High Court, then Supreme Court. There so many times, so many years we don't get proper judgment on that. So to avoid this tenure, they can withdraw the case, and if they say that our assessment of contribution is more, and they submit the records on the basis of their original records, we will again review the file and see what is the actual contribution payable to them, payable by them, sorry. And if he is not able to produce the record, there are cases we have passed 45 order on ad hoc basis. If employer is not paying contribution, we issue ad hoc notice. Ad hoc means assessment on assumed wages, and we pass order. If employer say that we are not able to come to for PH, then we pass ex parte order. So on ex parte order, another thing, if employer again comes to us during this amnesty period, then if he is not able to produce the record, then we can charge only 30% of the total contribution assessed by us, then he, and plus interest, then he can withdraw the case. He will, if he withdraws the case, we will ask him to pay only 30% of total contribution assessed by us or determined by us. Similarly, if the employer filed a case against damages, then this damages also will be reduced to 10% of the total damage amount if any other court cases has not decided otherwise. So this is the golden opportunity for all employers to avail this scheme also, amnesty scheme and SPREE. So this is the period they should avail, and all guests can convince your clients to get this benefit, to avail this benefit. Thank you. This is all what I wanted to say. Anything is there, then you can say.
Thank you, sir. Thank you so much. It was very informative. There are a couple of questions. Since we have some time, I'll try to pose those questions to you. So first question is from Anuk R. Is there any proposal to increase the monthly wage limit under the ESIC from present 21,000 to 30,000? If yes, from when it would be effective?
Yes, sir. There is a proposal. Proposal is there. Already proposal was given to government, and they are they have decided. I think within 1 or 2 months it may come. 21,000 to 30,000. As we got news, because this enhancement is being done by central government only.
Understood. Then there is one question from many audiences, and that's specifically for SPREE registration. Where they have asked that we have applied for registration effective 1st August 2025 under SPREE. However, the code which we have received under the letter, it says 0801-2025. So how to get this corrected? We have raised a question to the IT care, and they need some instructions from you.
Come again, what is the date? 1/1/8/2025.
So they have, in the application, they had mentioned 01/08/25, 1st August. But the code letter which has come, in that it is mentioned 0801-2025. So they are confused whether it is 8 January 2025.
No. It will be 1/8 only. Then particular that employer can text to us what is his code number. We will inform him.
Okay.
Vijay, it could be MMDDYY kind of a confusion, because the system may have generated date as MMDDYY, which is 0801, but it would be August 1st.
Yeah, perhaps. Ideally it should be, but a lot of employers have received that, it seems.
Any doubt is there, he can text us the code number. We'll provide the exact date.
Sure. Then very interesting questions from Trupti in terms of ESIC coverage. So they have one branch with 8 employees, which is in Delhi, and there is another branch in Pune with 2 employees. So total 10 employees put together. So whether ESIC is applicable to the company or not?
If the company is establishment, then yes. If a company is factory, then no.
Okay. So if it is
Factory means
establishment,
the company who is doing any manufacturing process. If it is an establishment, any shop, anything is there, any office is there, then yes.
okay. Okay. A
So the
related
two
question.
offices would be separate establishment, one in Delhi and one in Mumbai. They would have two separate establishment certificates under Shop and Establishment Act. So
No,
the
no,
limit
for
of 10
establishment, we cover total units. The
Okay.
person, the head office of the unit will be getting main code number, and the other office, branch office, will be getting subcode number.
So total we have to see as total how many employees the company has, right?
Total, we see for coverage, we don't see employee, we see person, total number of person. If per employee, we say the person who is getting less than 21,000 is called employee in our terms, in our definition.
Understood.
Person, we say, then other than that also, the person who is getting more than 21,000 is also person. So we say for coverage from 1/6/2010, we check only persons, number of persons. If number of persons are there in two units, two different places, and if it is an establishment, then it is coverable. If a factory is there, then 10% in one premises is required.
Okay. So even if it is a branch, two different branches, they will consolidate, and if the persons count is more than 10, then it is applicable.
Yes. More than 10 only.
Yeah.
10 plus.
Yeah. One related interesting question. They have 44 persons employed in different locations in India, and their employees' salary is more than 21,000, each of them 44 employees. Whether they need to register under ESIC?
Yes, sir. As I already told by madam also, the unit having 10 employees, either coverable or not, they have to register under ESIC.
And they will have to file their nil return since none
they
of
have
the
to file
employees
a return. They have to check the compliance of their contractors also. This is duty of principal employer to check the compliance. Suppose the security guards are there or the housekeeping are there. They have enrolled through contractors. They have taken the services of contractors. Then they have to check the contractors. If principal employer is covered, then only we can ask the compliance of the immediate employer.
All right. Then one question is for the benefit side from Mr. Nitesh, where he has asked a question. In case of a permanent disability or death, do employee will get pension from ESIC even if employee is registered under the scheme of EPFO?
Pardon, sir, 1 minute again, please come.
So the question is whether they get pension from ESIC in case of permanent disability even if employee is registered under the EPFO.
If employee is registered under ESIC, then only he will be getting the pension. If he gets employment injury, then only he will be able to get the permanent disability benefit if he is permanently injured.
Okay. So in that case, there could be situation where they can receive the pension from both the authorities, ESIC?
Yeah, 100%. We will be giving it.
Okay.
Whatever benefits are given to by another EPFO, or if he is an ex-serviceman, he is getting pension from other thing. Even in our from ESIC also, there are persons who are getting two pensions, one for finger cut and second for another finger cut. So even two pensions are getting from us also.
Okay. One interesting question where Mr. Santi Singh has asked in terms of the definition of wages. Many companies follow the CTC structure, right? Where the basic salary is there, convenience allowance is there, special allowance is there, HRA is there, LTA is there. So when they have to look at the definition of wages, what are the specific allowances which they can exclude it when they have to arrive at the 21,000 threshold limit to check for the ESIC applicability?
Sir, actually, from gross salary, first one, I'll tell you about overtime allowance. Overtime allowance is not actually, this is not come under the wage ceiling limit. A person is getting 20,000 rupees and he is getting 5,000 rupees overtime allowance. Then he is coverable. So 25,000 he has to pay, employer has to pay contribution. The overtime allowance is not included in the wage ceiling limit. This is the one part. Second part, what you have asked, what are the components of the salary which will not come under for the contribution calculation. First is conveyance allowance. Conveyance allowance from 2021 onwards, we don't consider it as a wage under section 222 of ESI Act. Conveyance allowance is not wage. Then washing allowance, if the person is getting lingering from the employer. Washing allowance is also not a wage. Then if any gratuity is there, leave encashment is there, annual bonus is there, any quarterly incentive is there, that is not calculated for ESIC contribution.
Okay. So one related question from me, sir. We have been talking about labor code for quite some time, and the ESIC Act will get subsumed under the Social Security Code, and the definition of wage in the code is a bit different from all these acts, and there say HRA is also an excluded component. So with that, do you see that a lot of people, there will be an extra workforce which will be covered under the ESIC, which is not getting covered because with the exclusion of HRA, the wages will come down for many people whose wages is currently more than 21,000, and they will have to be covered for ESIC?
No, actually HRA is included. Only conveyance allowance are excluded now. So basic, HRA, DA, any special allowance, whatever allowances are there, other than
I'm asking from the proposed labor code perspective. Once it comes,
if labor code comes, then we will see the labor code, what are the provisions of labor code, because there are so many amendments going on in the labor code itself. So what will be the final draft, we have to see that time. When this labor code implies, then we will see what are the provision in labor code. So from 2019 onwards, there were so many amendments in labor code. Still, it has not implemented.
So one related question from SPREE perspective, an audience has asked, they were supposed to take a registration a year back in ESIC, but they did not take the registration. Now under the SPREE, whether they have to take the registration from a prospective date or whether there is a possibility to take the registration retrospectively.
No, not required retrospectively. From the date when they decided, today if they want, they can take registration from the today itself. The date of registration and date of issue of C11 will be same. Means date of coverage letter and date of date of registration will be same. No need to file for any retrospective date.
Okay. One interesting question for companies having private group insurance. So if the company has the private group insurance for all employees, whether they have to take exemption from the ESIC specifically?
No, sir. As I already told you, this is ESIC is a mandatory scheme. If they have taken the ESIC registration for their coverable employee, they need not to take any other insurance scheme for them. Because already I told you under section 53 and 61, the other insurance scheme is not required. Like Employee Compensation Act or Maternity Act or any group insurance is not required. This is a mandatory. For exemption, there are other provisions which we can talk in detail later on. Okay. Exemption will be given by the state government, not by us. It will be given by state government. They have to apply to state government. If they have better facility than us, then they can apply for this. They have to provide all this death benefit, dependent benefit, and then permanent disablement benefit, maternity benefit. All these things they have to provide. Then that will be compared, and then exemption will be provided by the state government, or you can say appropriate government.
Understood. So one last question. Considering the remote work where the employees work from different states while their salary gets paid from an employer based in a different state. So there is a question. They have employees who are in Karnataka and Rajasthan, but the salary is getting paid from a Mumbai headquarter along with the ESIC contribution. How can these employees avail the benefits, whether they have to go to the ESIC in Karnataka and Rajasthan or whether it has to be in Mumbai?
As I said, sir, the branch offices have to take subcode number. There are several companies, though they have main code number in Mumbai, because most of the big company have registered office in Mumbai. So they have to take main code number in Mumbai, and different places, wherever their branch offices are there, they have to take subcode number. If they get subcode number, then their branch offices on that state, in that state, we will be providing them. Then they have to get the benefits from that branch office, or medical benefit from their state itself.
Great.
If they don't take the subcode number, then there will be difficulty for the employees to get the cash benefit from us.
Understood. Understood. I think, thank you so much. I don't have any further questions. Raki, over to you.
I have taken much time, I think.
No, sir, that was quite informative. I think the audience have found it, and you can see most of them have stayed with us through entire 1 hour, and there has been a lot of questions which has been posed.
If
and
they
you
are
can see the
satisfied, I am
reactions.
also satisfied.
Pleasure.
Thank you so much, sir, and Mr. Vijay. Thank you so much for this insightful Q&A also that we had. I do understand that there could be a lot more questions that our audience would want to get their insights on as human beings and as people who are working in this space and who are trying to provide as employers also very good experience to their employees, and employees just trying to get the best benefits out of ESIC. So a lot more questions are there, but I think what we can do, considering we have already covered most of it also, and we are at the end of the session, what we will do for our audience is share the email ID of the people who they can connect with from the SIC offices also, and along with our partners, Mr. Vijay's email ID. So anybody in the audience, if you have still any more questions, you can reach out to them directly, have those one-on-ones, because there are some questions that might require a deeper analysis, a deep dive that you can do in a one-on-one session. That we'll do. But having said that, thank you so very much once again, and for being here today. To Abhilasha ma'am as well for sharing all these insights. We started with the benefits by ESIC, covering the SPREE scheme, the amnesty scheme as well. So this was very, very insightful for both the employers as well as the employees. Thank you so much for taking out the time. It was wonderful to host you, and we hope to have more sessions with you in the future.
Thank you very much, madam. Thank you.
Thank you so much.
Yes, sir. Thank you.
Thank you.
Thank you so much. And of course, special thanks to our partners, Deloitte, for this webinar, to you, Vijay and Nitin, for being here with us, driving these conversations. And it was a pleasure to host you all as well. And of course, special thanks to our audience for tuning in, for staying throughout, as Vijay also mentioned. It was a very, informative session. And we are just very happy that we were able to give you the kind of experiences that you were looking at from this session. Thank you so much once again, everybody, for joining in. As promised in the beginning, the recording will be shared with all of you. So some questions that you might have, put in and might have not been covered, you could just watch the recording again and go through that. You would be able to see and get a lot of responses from the presentation itself. But apart from this, we will be sharing some email IDs with you all who you can, reach out to in case you have any more questions. Once again, thank you so much for being the part of our greytHR's Parichay webinar series. And we look forward to connecting with you in our next session, which is on 14th October. Till then, thank you so much, everybody.
Madam,
Yes.
1 minute. I also thank to Nitin Singhara, sir, who has organized this meeting, wonderful meeting, and thank to him also. And thanks
Thank
to
you.
all
Thank you,
members
sir.
who have listened us for this.
And my thanks to Sushil Kumar ji as well, because he is our point of contact and he's been
He is here only.
great help.
Come, Sushil.
Hi, sir.
Thank you, sir.
So
Thank
much.
you.
You are
Thank
the
you,
right
sir.
person to whom we contacted, and you made this webinar successful. And we have, if you required any kind of further information from ESIC side, we also deliver it to you as well as your team members.
Thank you, sir.
And thank you, ma'am. Thank you so much, Rakhi ma'am. Vijay sir, thanks a lot.
Thank you.
For being
Thank
with
you.
us.
Thank you, sir.
Thank you, sir. Thank you.
Thank you so much, everybody, once again. And we look forward to connecting with you all very soon.